Health TV. This video was created from an article on our health website. I'll drop the link to the article in the description box. After watching, please ensure you like, comment, subscribe, and share. And please come back for more.
All right,
See
let's
you
jump
soon.
right into this explainer and uncover the medical reality behind, honestly, one of the most talked about labor induction medications out there. Over the next 7 minutes or so, we are going to completely demystify a drug that has, quite literally, transformed modern obstetrics. If you're prepping for childbirth or honestly just fascinated by how medical science works, you are definitely in the right place. We're going to break down exactly what this medication is, how it actually works, and why it requires such incredibly careful handling.
You know, if you've ever been pregnant or even just been close to someone who is, you know exactly what those final weeks feel like. You're exhausted, everything's uncomfortable, and you are just so ready to finally meet your baby. And of course, that is exactly when all the well-meaning neighborhood advice starts rolling in. We've all heard those late pregnancy rumors about quick fixes, right? Like getting the so-called hot injection to just speed things up and get labor going. It sounds pretty tempting when you are days past your due date, but let's look at what the science actually says, because your body and your baby definitely deserve more than just neighborhood hearsay.
So the crucial point here is really separating those neighborhood myths from safe, supervised obstetric medicine. Look, labor is a natural process, and it usually starts on its own just fine. But sometimes, healthcare providers really need to step in and use artificial means to kickstart things. And this isn't about rushing the process just for convenience. It's a very calculated medical decision. One of the most common medications used for this kind of artificial induction is a drug called Misoprostol. But what exactly is that?
Well, misoprostol is a synthetic form of something called prostaglandin E1. Prostaglandins are actually these hormonal substances your body produces naturally. But here is the truly wild part. Misoprostol, it wasn't originally developed for pregnant women at all. No, it's actually an FDA-approved ulcer drug. It was created purely to protect the stomachs of non-pregnant people. But, as we'll see, doctors and researchers eventually stumbled upon the fact that it has this incredibly powerful secondary application, one that literally changed pregnancy care forever.
Now, what's really fascinating here is how the exact same medication performs two completely different, totally amazing functions depending entirely on the target organ. If it goes to work in your stomach, it acts like a shield. It creates this protective mucus layer to prevent acid damage and actually dials down your stomach acid production. But when it interacts with the uterus or the womb, it does something totally different. It actively breaks down collagen fibers to soften and open up the cervix, and it stimulates the muscles of the womb to start contracting. It's like one drug, but with two radically different biological responses.
Because it has such powerful effects on the uterus, doctors definitely don't just induce labor because a mom is tired of being pregnant. There absolutely has to be a valid medical reason. A real medical trigger where waiting for natural labor actually poses a greater risk to the mother or the baby. We're talking about situations where a pregnancy drags significantly past the due date, or maybe the mother develops high blood pressure or diabetes at term. It's also used if the baby's growth is a major concern, if the amniotic fluid drops too low, or if a mother's waters break, but for whatever reason those contractions just won't start.
So, if a doctor decides induction is absolutely necessary, how is this drug actually given? This part brilliantly illustrates the incredible precision required in obstetric medicine. You see, misoprostol usually comes in these 200 microgram tablets, but the World Health Organization's safe administration guidelines recommend absolutely tiny doses for labor induction. We're talking just 25 micrograms, given either orally every 2 hours or vaginally every 6 hours. Because lower dose pills aren't always sitting right there on the shelf, healthcare professionals actually have to carefully and precisely divide up these tiny tablets just to hit those exact super low dose WHO guidelines. And hey, while we are talking about administration, there is a massive red flag we really need to cover. Misoprostol for labor induction should never, ever be placed under the tongue or inside the cheek. You might be wondering, well, why does the specific location in the mouth even matter? It matters because you have to avoid these routes. The tissues in those spots absorb the drug way too fast. It literally forces the medication into your bloodstream almost instantly, and that significantly spikes the risk of getting hit with sudden, excessive uterine contractions.
Despite being technically an off-label use, it has major professional backing all around the globe, and for really good reason. It is highly effective at getting the cervix completely ready for birth and successfully kicking off labor. Beyond just its raw medical effectiveness, it's widely available in a ton of healthcare settings, it's incredibly easy to administer, and it's relatively affordable compared to a lot of other mechanical or medical induction options. Simply put, it gets the job done, and it does it efficiently. However, to keep things balanced, we absolutely must look at the serious risks, which really highlight exactly why this isn't some casual medication you can just take lightly. Common side effects can be pretty miserable, things like nausea, vomiting, fever, or diarrhea. But the severe risks, that's what obstetricians are really watching out for. It can cause uterine hyperstimulation, which means the contractions come way too strong and way too fast. And that can reduce blood flow to the placenta, leading to fetal distress where the baby's heart rate gets totally abnormal. In the absolute most severe, though thankfully rare cases, it can literally cause the uterus to rupture. And because of that specific risk of rupture, this drug is absolutely not for everyone. If you happen to fall into any of these specific categories, your doctor is going to steer you toward completely different, safer induction options. For instance, if you've had a previous C-section or any surgery on your womb, the risk of that scar tearing open, a uterine rupture, is just way too high. It's a hard no. It's also generally avoided for grand multiparity, meaning women who have had many previous childbirths, or if the baby's already showing signs of distress before the induction even begins.
Because of those high-stakes risks we literally just covered, this drug demands a highly monitored clinical setting. Doctors don't just hand you a pill and say, okay, see you later. No. They meticulously confirm the gestational age and the actual medical need first. Then they are constantly monitoring the mother's blood pressure, pulse, and the frequency of those contractions right alongside continuous monitoring of the baby's heart rate. And perhaps most importantly, it should ideally only ever be used in a facility that has immediate, instant access to emergency surgical services, just in case things go sideways.
Which brings us to a really critical warning, and I honestly cannot stress this enough. Buying Misoprostol over the counter, which yes is possible in some countries, and attempting to use it for an at-home labor induction is incredibly dangerous. Think about it. Without the continuous monitoring of the baby's heart rate, without knowing the exact proper microdosage, and without an emergency surgical backup right down the hall, you are putting both your life and your baby's life at extreme risk. It must only be done under trained medical supervision.
But if it is administered safely by your doctor in a hospital setting, here is what you can actually expect. Look, it's not like the movies where you take the pill and the baby magically arrives 5 minutes later. Expect a very gradual onset of contractions as your cervix slowly starts to soften. You are going to have to be patient here. There's typically a waiting period of several hours before active labor truly kicks into gear. And that timeline, it varies wildly for every single woman. Some need a few hours, others might need additional doses, or sometimes even a completely different method entirely. So as you prepare for your due date, use this knowledge to really advocate for yourself. We've seen how Misoprostol is this fascinating, truly powerful tool that has completely revolutionized pregnancy care, when it's used correctly, of course. But it absolutely requires precision, constant monitoring, and professional oversight. So I'll leave you with this. If induction gets put on the table for your pregnancy, are you prepared to ask your healthcare team the tough questions about why it's needed, what the specific risks are for your unique body, and exactly how you'll be monitored? Because having the right questions just might be the absolute most important tool you bring into that delivery room.
Please subscribe.